We are in the midst of a silent epidemic. It doesn't discriminate. It affects people of all ages, backgrounds, and walks of life. This silent epidemic is metabolic disease, and it's sweeping across the US and Mexico, leaving a trail of suffering in its wake. Metabolic diseases are a group of conditions that disrupt the body's natural processes. These include diabetes, heart disease, stroke, and some cancers. They are often silent, developing slowly over time with few symptoms until it's too late. The statistics are alarming. Millions are affected. Even more are at risk. This is not just a personal health crisis, it's a societal crisis. It impacts our families, our communities, and our economies. We need to wake up to the silent epidemic of metabolic disease. The good news is that we have the power to fight back. By understanding the causes of metabolic disease and making lifestyle changes, we can lower our risk. We can also work to improve access to healthcare and support those who are living with these conditions. It's time to break the silence. We must take control of our health and work towards a healthier future. It's time to turn the tide on this epidemic.
Diabetes is a prime example of the devastating impact of metabolic disease. In this tale of two nations, the US and Mexico face strikingly similar challenges. In the US, over 37 million people have diabetes, with a staggering 96 million adults having prediabetes. South of the border, the numbers are just as grim. Mexico grapples with one of the highest diabetes rates globally. Over 12 million Mexicans live with the disease. These numbers tell a story of unhealthy habits and inadequate healthcare systems. In both countries, access to affordable, quality healthcare remains a significant barrier. This is particularly true for marginalized communities. The economic burden of diabetes is immense. The cost of treatment, lost productivity, and disability weighs heavily on individuals, families, and national healthcare systems. This shared challenge presents an opportunity for collaboration. Both countries can learn from each other's successes and failures in addressing this complex issue.
The rise of metabolic diseases like diabetes is inextricably linked to our modern lifestyle. Unhealthy habits are fueling the fire, pushing our bodies to the brink. The culprits are all too familiar. A diet high in processed foods, sugary drinks, and unhealthy fats, coupled with a sedentary lifestyle. We are eating ourselves sick. The abundance of cheap processed food has created a recipe for disaster. These foods, often laden with sugar, salt, and unhealthy fats, contribute to weight gain, insulin resistance, and inflammation, setting the stage for metabolic disease. Our sedentary lifestyles are adding fuel to the fire. We spend hours sitting at desks, in cars, and on our couches. This lack of physical activity further exacerbates the problem, disrupting our metabolism and increasing our risk. We must break free from these unhealthy habits. It's time to reclaim our health by embracing a balanced diet rich in fruits, vegetables, and whole grains. We need to incorporate regular physical activity into our daily routines. Section 4. A nation divided: disparities within the U.S. While metabolic disease affects all Americans, certain racial and ethnic groups bear a disproportionate burden. This stark reality highlights the deep-seated health disparities that plague our nation. African Americans, Hispanic Americans, and Native Americans are at increased risk of developing type 2 diabetes compared to non-Hispanic white Americans. Several factors contribute to these disparities. Socioeconomic factors, such as poverty and lack of access to quality education and healthcare, play a significant role. These communities often face limited access to healthy food options and safe spaces for physical activity. Cultural factors, including traditional dietary practices and beliefs about health and illness, can also influence risk. Additionally, genetic predisposition may play a role in some cases. Addressing these disparities requires a multi-pronged approach. We need to improve access to quality healthcare, education, and healthy food choices in underserved communities. Culturally sensitive interventions that address specific needs and beliefs are also crucial.
Section 5. Bridging the Gap: Public Health Strategies. Combating the growing burden of metabolic disease requires a proactive, multifaceted approach. Both the US and Mexico have implemented public health strategies, but there's room for improvement. Prevention is key. Public awareness campaigns can educate the public about risk factors and encourage healthy lifestyle changes. Early diagnosis is crucial. Regular health screenings can detect early signs of metabolic disease, allowing for timely intervention. Mexico has made strides with its national strategy for the prevention and control of overweight, obesity, and diabetes. This program focuses on promoting healthy lifestyles and improving early detection. The US has initiatives like the National Diabetes Prevention Program, which provides evidence-based lifestyle change programs. However, these programs need to be more accessible and tailored to diverse communities. Management of metabolic diseases is equally important.
Section 6. The Way Forward. A Call to Action. The rising tide of metabolic disease is a complex challenge that demands a united front. We need a call to action, a collective effort to stem the tide and create a healthier future. This requires a comprehensive approach that addresses individual behavior, healthcare systems, and societal factors. Individuals must take ownership of their health. Adopting healthy lifestyles, including a balanced diet and regular exercise, is crucial. We must empower individuals with the knowledge and resources to make informed choices. Healthcare providers play a vital role. We need to improve early detection and management of metabolic diseases. This includes making healthcare more accessible and affordable. We must address health disparities by ensuring that everyone has equal opportunity to achieve good health. Policymakers have a responsibility to create an environment that supports healthy choices. This includes implementing policies that promote access to healthy foods, encourage physical activity, and support early detection and management of metabolic diseases. We need to invest in research to develop new and innovative ways to prevent, diagnose, and treat metabolic diseases. This includes exploring the role of genetics, environmental factors, and social determinants of health. This is a call to action for individuals, healthcare providers, policymakers, and communities to come together. We must work collaboratively to address this pressing public health crisis. Let's turn the tide on metabolic disease and create a healthier future for all.